Hello, I'm Ty Mason of the DiabetesCouncil.com, researcher, writer, and I have type 2 diabetes. I want to emphasize that my perspective is coming from one with type 2 and not type 1 diabetes. Our channel is primarily for those with type 2 diabetes and pre-diabetes. Today, I want to answer the question, will I lose my feet because of pre-diabetes? After you watch the video today, I invite you to check out the description box for my new ebook. This is one of the most comprehensive diabetes meal planning books you'll find anywhere. It contains diabetes-friendly meals and recipes for different goals, such as 800 to 1800 calories per day meal plans, diabetes meal planning tips and tricks. There are also tons of diabetes-friendly recipes for everyone. Now let me state up front that the chances of someone with pre-diabetes losing a foot to amputation because of the disease is highly unlikely. I have found no cases in my research. But why would someone ask this question in the first place? Well, diabetes can lead to complications in which amputation may be necessary. Let me explain with the help of the American College of Foot and Ankle Surgeons. People with diabetes are more susceptible to foot problems, often because of two complications of the disease: nerve damage, called diabetic neuropathy, or poor circulation. Peripheral neuropathy causes a loss of feeling in the feet, reducing the ability to feel pain or injury. Poor circulation diminishes the body's ability to heal, making it difficult to resist infection and heal injuries or wounds. For a person with diabetes, these complications can be deadly combination. When a person with diabetes has neuropathy, they often can't tell if their shoes are causing pressure and producing corns, calluses, cuts, or blisters. These minor foot injuries can develop into ulcers, which is a break or hole in the skin. With poor circulation, the ulcers can become infected and they may not heal properly. Now, this is a common complication associated with diabetes and can lead to a chronic foot ulcer, which is the leading cause of amputation. Amputation is considered when healing potential is poor or a serious infection becomes widespread and could threaten the patient's life. Now, let me reiterate. This is talking about diabetes, not prediabetes. However, we have discussed that prediabetes can lead to type 2, so I think it's important that we talk about these. Now, to prevent these complications, it's vital to take preventative measures to care for your feet, including wearing proper shoes, daily foot inspections, and regular exams by your healthcare provider or even a podiatrist. Even the smallest foot problem can turn into serious complications. It's important to seek treatment early for any issues, especially minor cuts, blisters, corns, and calluses. Now, when complications arise, the loss of life and limb are real concerns for those with diabetes who have a serious infection. Physicians and patients must work together to consider the best options to treat that infection, prevent limb loss, and to get the patient as well as possible. Now, amputation is a complicated, and it's something that both patients and physicians work hard to avoid if possible. It is estimated that nearly 85% of amputations are preventable with education and early intervention. Amputation should not always be seen as a failure of treatment, but sometimes a faster, more reliable means of rehabilitation in order to return to activities of daily living. Surgery may be the best way to control a severe infection. That could require a more traumatic amputation in the future, or that could otherwise prove fatal for the patient. After undergoing an amputation, patients often experience improved general health because the severe infection has been resolved. Now, amputations do not always mean loss of an entire foot or leg. Surgical intervention is performed at many levels, including partial toe amputations, partial foot amputations, or below-the-knee amputations. A foot and ankle surgeon will make a thorough assessment and determine the best method of getting the patient on the road to recovery. Now, as stated earlier, the likelihood of one with prediabetes losing a foot is extremely unlikely. However, those with type 2 are at a higher risk. So let's watch those feet. Let me give you a quick lesson in foot care, and this really should become a daily routine for you. Inspect your feet. Check your feet and toes, inspecting the tops, sides, soles, heels, and the area between your toes. If you're physically unable to inspect your own feet, use a mirror or ask someone to help. Contact your doctor immediately if you discover any sores, redness, cuts, blisters, or bruises. Wash your feet every day in warm water with mild soap. Hot water and harsh soaps can damage your skin. Check the water temperature with your fingers or elbow before putting your feet in. Your diabetes may make it difficult to sense water temperature with your feet. Be sure to dry your feet. Pat them dry and make sure they're dried well. Infections tend to develop in moist areas, so make sure you dry the area between your toes very well. And moisturize your feet. If the skin on your feet feels rough or dry, use lotions or oils, but do not use them between your toes. This is a very important thing we're talking about here. Very important stuff. Make sure you take care of those feet. Don't forget to get my new ebook, and please subscribe to our channel for many more videos like this one in the future. Thank you so much for watching. I'm Ty Mason.